Now we get to look at another complication of diabetes mellitus, and this is what is always what abbreviated as GDM. Okay, almost always when you see GDM in any medical book, they're actually talking about gestational diabetes mellitus. All right, and when you're talking about gestational, you're trying to say somebody is pregnant. Diabetes mellitus that occur or get worsened in pregnancy. Do you understand? Okay, so it's a pregnancy related issue and affects the baby. Too much glucose to the baby makes the baby too big. So when the mother is giving birth, the baby is too big, so it can lead to all those birth complications and birth traumas. Okay, the link goes down. So it's a type of diabetes, and it develops during pregnancy, or it could be that the person already has pregnancy, so it got worse. You know, so it's due to hormonal changes that cause insulin resistance. So a lot of hormones are interplaying, and the mother is no longer how like responding to insulin very well. Do you understand? So it affects a lot of pregnant women. Okay, and sometimes, most of the times, pregnancy is complicating it. So once you give birth, that's all right. So it's high blood sugar. Okay, this one they are strictly trying to talk about the one that occurs as a result of pregnancy. But somebody can already have diabetes and pregnancy complicates it, but that one is not really gestational. You understand? It's just complicated by pregnancy. So causes is placental hormone, estrogen, cortisol, human placental lactogens. You know, they are being released so much during pregnancy. So they are making it that the body is not responding to insulin very well. So typically in the second trimester, 20 to 28 weeks. And once the person gives birth, it usually, disappears. So risk factors is if the mother's age is more than 25 years, if the mother is already overweight or obese, if the mother or the family has a history of type 2 diabetes, and probably in her previous pregnancy she suffered from the same condition, the polycystic ovarian syndrome. Then if the mother is African, Asian, Hispanic, Native American, So symptoms, most of the times no symptoms, but sometimes you have symptoms of diabetes, like she's thirsty, she urinates very well. So she's losing so much water, so she wants to replace, she's weak. Okay. And most of the times you dictate it when you are doing some general antenatal test for pregnancy. So diagnosis, they usually use the glucose challenge test where you drink a sweet liquid and blood sugar, you check it after 1 hour. And also the oral glucose tolerance test. You do it. The standard screening at 24 to 28 weeks of gestation. So complications, it could lead to preeclampsia, increased chance of cesarean section because the baby is too big to pass through the birth canal, you know, greater likelihood of developing type 2 diabetes later. So for the baby is too big, neonatal hypoglycemia, you know, breathing problems at birth, high risk of obesity and type 2 later on in life. Yes. So management is the mother should control her carbohydrate intake, you know, regular exercise, blood sugar monitoring. Okay, so you can also be giving some insulin stuff, okay, to further help so that the mother's body is actually responding more to insulin, so that glucose is broken down more.